WHO designate variant of concern taking following criteria. Maybe there may be many, but some of the criteria are very important, like it increases the transmissibility. One is that. Another one is it evade the immunity. Whatever immunity you have, it is evaded. Another criteria is that whether it becomes serious, more dangerous. Then there is also possibility that a new variant could be more different presentation, like clinically it is different. So following criteria used to label some virus to be a variant of concern. So this new Omicron has been identified that it has multiple mutation in the surface antigen, and they are quite big number, like almost reaching to 34 types of the. So that leads to a kind of change in the presentation of the clinical case. But what has been observed that this has been labeled as variant of concern, only not taking all the criteria but only just one or two, and seeing that transmissibility of the virus is quite high. Therefore they have taken it as variant of concern, because it is increased from 70%, which was found in Delta, 70% from the previous variant. It reached to 400 to 500 times higher, so which is quite high. In India we are having very less number, and in many countries where it has appeared, it is mild in nature. There are chances that you can have another mutation which can be more dangerous. Therefore, we have to always take care of. But at the individual level, we will say that continue to have the same kind of prevention or protection, whatever we have. You have to wear the mask and you sanitize everything and be taking care of yourself. Particularly it's a hygiene which is more important. The स्वच्छता जो government का एक motto है वो continue रहना चाहिए. And beside that, one should have the vaccine at the individual level. In the community level and the state level, the guidelines has already been issued by the ministry, so they has to be followed. The point is that it should not be circulating. The infected person is going everywhere. So one should restrict such kind of interaction or movement, because if it goes to the area where still we have very less number of vaccination, or maybe already the infection has not occurred in that area, maybe I think this infection will be transmitting very fast and infecting large number of people. And also we should not go out unnecessarily. If we can have this much, I think community can do good. The virus is same, infectivity has increased although it is mild, so we have to apply the similar kind of, rather in more intensive way, because it's more infectious. One should keep the distance, masking properly, that's all. When you infected, when you have some sign symptom, you should always wear the mask. Otherwise, there is no problem, but when you have some problem, you should always wear mask.